Retiree health benefits are becoming scarce, with just over 20% of large employers offering them in 2023. Get ready to explore why this is happening and discuss your options. Whether it's a marketplace plan or Medicare, we have you covered coming up today on Retire Smarter.
Hey, welcome to another edition of Retire Smarter. I'm Walter Stroholt alongside Tyler Emrick of True Wealth Design. Tyler's a wealth advisor and certified financial planner, also a chartered financial analyst to the team serving you with offices in Ohio, Southwest Florida, and the greater Pittsburgh area. But doesn't matter where you are, you can enjoy the show at truewealthdesign.com and also schedule a 15-minute call with an experienced advisor on the team there, truewealthdesign.com. Tyler, great to be with you this week. Hope you had a great Memorial Day, and you told me before we got started today you finally got your yard work done to kind of prep the yard for the rest of the summer, so you got it in under the wire, my friend. I did.
I feel like this weekend every year, it's like I start getting a little anxious if it's not done by this weekend. So yes, it was the Emrick household was working this weekend, which was good. Even the little ones got out and did their picking up sticks, even though I feel like they rode in the wheelbarrow more than they picked up sticks. But hey, well, we got one of those little like,
if they're not going to contribute, they can at least ride in a wheelbarrow and look cute, right?
Yes. And technically I upgraded my wheelbarrow. Now I have like one of those little like pull behind trailers that it kind of dumps up. It's still very, very small, but they both can just fit in, and they love bebopping around the yard in it. They get a kick out of it. So
nice.
It was pretty good.
Yeah.
But yes, all yard work is done. Big check mark off the list, that's for sure. Well, at least all yard work is done for now.
I'm glad to hear it. Well, hopefully everybody's prepped for an exciting and safe summer ahead, and that dovetails nicely into our conversation today. Tyler, you teased it already, talking about retiree health benefits becoming more scarce, and a lot of retirees these days kind of wondering what options they have in this arena. And I know it gets even more complicated if, depending on when you retire, can change the dynamics. And so there's a lot to dive into and to understand here if someone's never done a deep dive on health benefits for retirees and what's different from maybe our working years and from previous parts of life. So can't wait to hear all the details and everything you've got in store for us today.
Sure. I don't think it's going to come to a surprise to many of the listeners that, retiree benefits are kind of going by the wayside. A lot of the healthcare data that we use comes from KFF.org, is the Kaiser Family Foundation. They do a lot of studies and a lot of good work on just health benefits in general. And their 2023 employer survey, really hit home a little bit when I was kind of going through it. And they were just talking about how over the last few years, the employers offering benefits to their retiree benefits to their employees had dropped fairly substantially. I think it was just under 30% in 2020. And then in 2023, we're down to about 21%. So a pretty substantial decline just over a few years. And again, I don't think it's too way out there in left field that this is happening. It's pretty common. I think there's a handful of reasons for it. I mean, shoot, Walt, you can look at the rising healthcare costs. KFF mentioned, union membership decline. Certainly the change in Medicare benefits over the years has, probably played a part into employers backing out of this space. But it seems like, almost the perfect storm over the last number of years to where, a lot of families and a lot of individuals heading into retirement or transitioning from their job are really out on their own to kind of wade through some of their options and look at what might be out there. So we figured today we would, kind of take a look and dive into some of those options and give a high level and sometimes, more granularity on what those options look like and, how you start to tackle some of those decisions, whether you're pre-65, over 65, or whatever the case may be. We kind of have you covered here today, diving into it.
I'm interested in this, Tyler, because I just look at the emotional side of it and also the logical side of it that says, all right, I'm getting older, I get into retirement, my healthcare needs, we've shared how much it's going to cost us in the future on previous podcasts, and I'm sure we'll hit those figures throughout the show today to give that some context again. But we know that need's going to be there. We know all the stats of how many of us are going to end up in probably assisted living or needing some sort of long-term care situation. You wrap all of that together, and you're like, oh, big issue. And yet we have evaporating support. And so it's like, oh, that's a bit of a nerve-wracking situation in somebody's portfolio that often sounds like, just from talking to you over the years, Tyler, it goes unaccounted for in a lot of financial plans, and that just sets us up for an even more important discussion.
Yeah, that's right. Well, and I would take that one step further, Walt, and I think there's some nerves around it as well. And I think, frankly, anytime there's nerves involved and maybe things might be a little bit gray and individuals might not know the full breadth of what their options are, maybe that can lead to decisions of, well, hey, I'm just going to work till 65 and I'll be able to get Medicare and I don't have to deal with any of those other options or sift through. And they kind of just go into that camp that says, hey, Medicare costs are, so outrageously high, there's no way that I could retire, before 65. So we want to really stay out of that camp and, really bring some education to it and say, hey, how can we make a little bit more informed decisions and really say, hey, what does your specific situation look like? And, how those costs might vary depending on what might be afforded to you there. And those costs, I mean, you're right. I mean, I think the last data from Milliman for 2023 said the average, family of four is paying a little over $31,000 a year. Total healthcare costs. Now, some of that's covered by the employer as well, roughly around 60% on average, but still a pretty staggering number. If we kind of, boil that down to just a family of two between ages 45 and 65, then, that number does drop to about 25,000, but it doesn't drop fairly substantially. So in either case, we're looking at a pretty hefty number. And of course, when we run our projections and we're doing our plans, we're increasing those healthcare costs by a little over 5% per year. And anywhere between 5 and 6%, most studies are showing that that's what they're expecting those costs to continue to go up by. So it's not going away anytime soon, Walt, and could become more and more of a cost of family households as you progress through retirement. So let's dive in and take a look at some of those options. And the first one we'll take a look at today is going to be COBRA. I'm sure many listeners are familiar with COBRA, or at least have heard the term. You know where COBRA started from, Walt?
No, I don't.
Okay, fair enough. So I didn't know actually until I looked it up, but the Consolidated Omnibus Budget Reconciliation Act of 1985.
Man, that old omnibus, that really gets you, doesn't it?
Yes, absolutely. Well, I had to look up and make sure I pronounced it correctly. I think I got it.
What does that word mean?
I did. Wait, what are we looking at there? But it's been around for a while. And, the way I tend to think about COBRA.
That's one of the few times where the acronym actually definitely helped to shorten that up a little bit.
It did,
we have so many acronyms in this financial world that it's like, all right, it's too many. That one was a good one to put in place.
Yeah. COBRA is approved in my book, no doubt about it. But, when we look at COBRA from a high level, what we're looking at is essentially this is going to be coverage, your employer coverage continued. Okay. There are some stipulations where you have to work for an employer that has a certain amount of employees. I think the number we typically see is 20 or more employees. And essentially legally, that group healthcare coverage has to be available to you once you leave employment, whether that's for retirement, you get laid off, whatever the case may be, for up to 18 months after you lose your employer-sponsored coverage. Now, of course, the term on this can change. I mean, there are a handful of scenarios where you can get COBRA for longer than 18 months, up to 36 months in some situations. But for the vast majority of us, that 18-month window is going to be the one that you have to abide by. So you think about the pros of COBRA, in my mind, I think the big one is you're going to be able to maintain that same coverage that you had through your employer, which a lot of us are familiar with and comfortable with. Certainly your family can stay on that health care as well. So if you have a spouse, you have children still under that plan or whatever the case may be, COBRA is going to allow them all to stay on that. And then, of course, when we look at those employer plans, sometimes, depending on the plan, they can provide, broader networks or at least have the doctors that you utilize in those networks because that's what you've been using for your time working at that employer. So those are some really strong pros to COBRA. But just on the flip side to that, I think there's some big negatives as well that you need to be mindful of when you're thinking about utilizing COBRA. And the biggest one comes down to cost. Walt, COBRA is not the most inexpensive option that is out there.
Yeah, you're not going to be doing anything else fun for a while you're on COBRA. At least that's the way it feels.
Yes. No, if anyone's been on it listening, that those bills can be pretty substantial. Legally, they can charge you up to 102% of your current premiums. So that 2% is like an extra admin charge that they're able to, to kind of flow down through. And of course, those premiums are not just what you were covering, but also what your employer was covering for you as well. So I think that's where some of the shock comes into play.
It does put into perspective the value of getting those kinds of benefits through your employer.
Yes, absolutely. It is a cost. I mean, we go back to at the beginning there, Walt, where we said about 60% of your healthcare costs are covered by your employer. A lot of that goes down to them covering a portion of those premiums. Of course, not every employer helps you with those premiums, but a good amount does. So it can be pretty pricey. I don't want to throw out numbers, but they can range drastically. Certainly, some individuals can look at their pay stubs, and the employer's portion of the premium is on there. Sometimes, certainly, you can call your current healthcare provider, and they can give you some estimates on what that COBRA would be if you're starting to plan and maybe looking at making a transition or going into retirement. And you're trying to wrap your arms around, well, hey, how much would COBRA be if we wanted to utilize that as an option or potentially use it as a bridge? And that's where I see it used the most, Walt, is as like that bridge insurance to get you to, say, 65, for example. So 63 and a half is a pretty important age in my book, because that is something to where, hey, at least you can get COBRA for 18 months and bridge your gap to age 65 where you go on to Medicare. And I see a lot of families using COBRA, in a scenario like that, to help them get them to it. Even though the costs are there, they build it into the plan and they want to maintain that employer coverage that they're used to. Now, of course, too, that timing and is very important as you think about COBRA. Well, you got to make the election. I think it's within up to about 60 days from leaving your employer. And once you route outside of that window, it's not like you can get back onto COBRA. So it is a decision that you do need to be prepared for if you can, so that way you can be very diligent about those deadlines and make sure that if you want to stay on it, that you can. I would say another little trouble area or something to consider as you're weighing your options there with COBRA would be too, how much of your healthcare have you already used in that particular year, and how much do you expect to use for the remainder of the year? I've had an individual where she was looking to retire, and she actually had used quite a bit of her medical earlier in the year, and she thought that she was going to use it going forward. So she had already hit that deductible. So by her staying on COBRA, yes, she had higher premiums, but that deductible was already met. Whereas if she would have switched over to one of her other options, she would be going under a new plan, a new deductible, and kind of starting that cycle over again. So that's something just to be a little bit mindful of as you're kind of weighing your options down. But COBRA, I think, is the one that comes to mind for most individuals when they think of, hey, I've lost my job or I've retired, or my healthcare, where's the first place I can go to healthcare? COBRA, seems to be that first place that comes up to everybody's mind, I think.
Never thought about that angle of it with if you've already used a bunch of your benefits, instead of switching to a new plan all of a sudden and losing all of that.
It very well could be.
Let's start chopping things off, right? Like end of the year, what do we need to do?
Well, and you think about the end of the year, a lot of the open enrollment time periods for a lot of these other options that we'll be talking about is traditionally towards the end of the year, around that November, December timeframe for the upcoming year. So you think about utilizing COBRA for the year that you leave your employer, and then maybe looking at that upcoming year as a fresh new year and really diving into your options, saying, all right, hey, maintaining that COBRA coverage, is that going to be best for me? Or, hey, do I want to utilize this open enrollment period to maybe go on a marketplace plan, which is the next plan that we want to spend a little bit of time talking about, and is, in my book, kind of a second option to look at, and that's just a marketplace healthcare plan. Now, these plans can be called a number of different things: Obamacare, ACA plans. You might hear me refer to them quite a bit as ACA plans. That just stands for Affordable Care Act plans. But these are the individual plans where you would just go out on the healthcare.gov and shop around and say, hey, what healthcare coverage can I go and get? And when you think about the benefits of a plan like this, I mean, one, you can go into them if you have a special enrollment period. So like losing your job or getting laid off, that triggers a special enrollment period for you to be able to go and transition to a marketplace plan. And they also allow you to pair these plans with some other benefits that the government will provide. So, for some individuals and some families, going on a marketplace plan is substantially cheaper than staying on COBRA. And the reason for that is because that there are government subsidies that are afforded to individuals depending on their income to help them with those premium costs. I have, 2 handfuls of individuals that are on marketplace plans right now, paying, a couple $100 a month for their premiums, some even less, some more, but, it really depends on the amount of income. And we've talked about it, I think, many a times on the podcast before, Walt, but that income is going to drive a lot of those decisions and how much of those premium tax credits and subsidies that you can get from the government to help lower those healthcare premiums. Now, so the pro, I think, is having the ability to manage, if you have the ability to manage your income, potentially getting premiums a little bit lower. But there are some absolute downsides to marketplace. And the first of which is just the flip. Well, hey, if you can't manage your income and you've worked or you're working and you have substantial income coming in, then these plans can be just as expensive as COBRA, and in some cases more expensive than COBRA because you're not getting those tax credits. And the other thing, when I think about some of the negatives about these plans, is they are very specific to where you live. So even in my case, we have offices spread out across Northeast Ohio and into PA. And those plans for families that are close to each one of those offices can be very different. And the health systems that are available to individuals, depending on where they live, can be very different as well. So finding a plan that has your doctors in it can be daunting, certainly can be easy if all your docs are in the one that's offered. But where you live can determine how good some of those plans are. And then, of course, like we mentioned with COBRA, you're staying on the same plan, so the deductible transfers over. This would be a new plan, so you are starting a whole new deductible if you go on to a marketplace plan. So you're kind of starting from scratch. Even if you jump on a plan in June because you lost your healthcare coverage for whatever reason, then that deductible will start then, and then you'll go from there. But these plans are afforded to just about anyone. They have certain rules and requirements that they have to abide by from a benefit standpoint to be eligible to be on the marketplace plan. So it's a wonderful place to start as you're kind of weighing out your options outside of COBRA. And the easiest way to look at these things is, one, if you have our office here, a lot of our families just come in and meet with our healthcare plan specialist and their advisor in a joint meeting, and they just kind of go down each of those options. They run your scripts, they run your doctors, and really just kind of look down and say, hey, this is going to be the best plan that's available to you. Here's the premium. Hey, this plan's paired with an HSA. It's not. And just really kind of go through those pros and cons and narrow down your options to, well, what plan would be good for you, and then that'll be a nice comparison tool that you can use towards maybe the COBRA that would be afforded to you as well. All these plans are available on healthcare.gov, where they kind of outline them, and you can put in your information to do it. So it's not a daunting task, and the information's out there, but as a financial professional, we're certainly here to help you, kind of wade through some of those decisions and make sure that you get the appropriate plan for you.
That's great. I think that it's nice to have options, right? And so the fact that we've got COBRA, we've got this marketplace. I mean, I would love more than the 2 routes to take if I'm retiring. Yes. And I've got this big hole and gap to fill in my plan. But hey, 2's better than 1. But are there any other areas that we can turn to here, Tyler?
There are. Now, okay. These other areas can get a little bit more granular as well and apply in certain situations. So the one we'll talk about now is the small business multiple employer welfare arrangement. We call them MEWA plans. I know that's a mouthful.
Not as smooth as COBRA.
Yes. And here in Northeast Ohio, these plans are offered through like the local Chamber of Commerce, and you can get them in a few other ways as well. But essentially, they are healthcare plans that are available to individuals that have a small business or are a consultant and have 1099 income. So I have this a lot with, or I've ran into it a lot with individuals that are, let's say they're semi-retiring, where, hey, they want to kind of go and do their own thing, or they want to go back and do some consulting work. They're not 65 yet, so we don't have access to Medicare. And we're going through and looking at their healthcare options saying, well, hey, if you're going to have some 1099 income coming in, we could get you eligible for these MEWA plans, which when we look at the benefits afforded to them, one, the premium has nothing to do with the amount of income that you have coming in. So if you're an individual that is this 1099 income, or your small business is, putting a lot on your tax return, these plans might be a very, very nice option. I think back to an individual that, I've been working with for a few years now. They were on a marketplace plan. She was a consultant. She's been a consultant, had her own business her entire life. And she thought the marketplace was the only place to go for small business owners or contractors to get their health care. And we went down the route of looking at the MEWA plan. And for her, the premiums after they went through underwriting, we were able to get them put in place. The premiums were about half what they were on the marketplace for her and her husband. So these can be a really, really good option if your situation allows you to get through them. Now, of course, the downsides of these plans too are you do have to pass underwriting to get on them. So individuals that maybe use a lot of healthcare, this might not be an option, but I think it's still worth going through the process if you're an individual that's going to have, some income coming in to where, it's worth the exercise to go through to see if you would be able to get on them and get approved for it. Because if you do, the plans that are afforded, at least here in Northeast Ohio, are wonderful. They have very, very large networks at a very reasonable cost. You can pair them with, an HSA, and you'll really, do some good planning work around these MEWA plans. And not a lot of individuals know that they're out there. But again, they're very specific for individuals that are still going to have some income coming in, whether it's 1099 or maybe a small business owner with 1 or 2 employees might be able to, this is a good option for them to look at as well. So as we're, in the spirit of this granularity and some of these other unique options that are out there, we can kind of shift gears a little bit. And there's these plans called health share plans or health share ministry plans. You ever ran into those ones, Walt?
Yes, I've used some health share plans before, or kind of in this genre to help fill not retirement gaps, but some other gaps in healthcare coverage throughout our working lives.
Okay, wonderful. No, I've had these are less common that I've ran across. Maybe just a couple of times I've ran across them, but when they work, they seem to work out pretty well. And they're faith-based alternative. So generally, coverage is limited to like your basic healthcare and catastrophic care. So you got to be a little mindful of that and how often you're using this. I think going back to your comment, Walt, about, hey, we just want to make sure that we are using this for a specific purpose and understand, kind of what some of the limitations are in the coverage. And there are, some trickiness to getting onto some of these plans as well. Sometimes you might have to, submit a statement of faith, or, there might be some pre-existing thing that you need to do or be a part of to get access to these. But if they work in your situation, they can be a wonderful stopgap, to get you to Medicare or, get you some short-term coverage should you need it.
I remember from when we had to do it as well, like you can't smoke. It's not just like your rates would be increased. You would be disqualified pretty much right off the bat. And then even, drinking to excess is something that you have to attest to that you're not doing. I remember a few other stipulations like that. So it's definitely can be a bit restrictive. There's things like you can't join while you're pregnant and expect the pregnancy to be covered. I guess that would kind of be under the pre-existing condition sort of conversation.
Yes.
So you'd have to wait a little while before something like that would be covered. And I remember there are differences, quite vast differences between the plans under this umbrella. There are some that work a little bit more like traditional insurance. Others work a little bit more like just truly catastrophic coverage and insurance. There's all different levels and plans, and that's how we used it, Tyler. It was mostly just catastrophic. Both were, Connie and I were both young, and we were like, you know what, we don't want to spend. We're not going to the doctor. We don't want to spend $800, $1,200, $1,500 a month on healthcare coverage at our young ages. Like, that's a big portion of our paycheck every month. And this was an opportunity to pay like $200 a month for just purely that, like, okay, if I get hit by a bus, we won't go bankrupt. We would be covered under this. But for everything else, we're just going to pay out of pocket for all of our regular routine stuff. Oh, I have a cold. I'm going to go to CVS and get an appointment for, $99 and get some medicine and, be good to go. I don't need to pay premiums to cover something like that. So that was our line of thinking. It helped save us a ton of money during that time period, but we had the safety net that if something did go wrong, we would have been covered. So I think it served its purpose really well.
Sure. Oh, absolutely. And if you're listening going, hey, this isn't my niche, this isn't necessarily going to be applicable to me, I think you can look at just general private health insurance now as maybe another alternative to these health share plans with some of the same pros and cons where, you go into one of these private health insurance plans, which you can get at, through a broker, or a lot of the health insurance providers are going to, have these available to you. Those pre-existing conditions can sometimes be an issue. With the private health insurance as they are with the health shared ministries. But if you're in good health and you can get through underwriting, then this can be a very fine option as well. Now, the benefits, I think, to your point, Walt, can be much more just for catastrophic coverage only. So for a short period of time, I've had families use private health insurance, for a short period of time to bridge a gap to get to, say, 65, right? Hey, they just need it for a year. They're in relatively good health. Their income was high enough to where, and their health was good enough to where they thought that private health insurance was a good fit for what they need. But I think as with any of these options and any of these plans, Walt, I think the important thing is truly understanding what the benefit is and what maybe that worst case scenario could be from an out-of-pocket standpoint. So that way you just truly understand and can kind of fit it into your specific situation and be comfortable with the level of coverage that you're getting. So we've talked about heavily around options that are afforded to individuals pre-65, right? We went through COBRA, we went through Marketplace Plan, we talked about the MEWA plans, the health share plans, private insurance. I mean, there's a whole host of them here. But at the end of the day, once you get to 65, you are eventually going to be available and be eligible for Medicare, Walt, which that's why that age 65 is just so important.
Yeah. It's definitely a target date for a lot of people, right?
It is, right? And at 65, that's when you're eligible for Medicare. Certainly, as you think about Medicare, there's a whole host of things to get into. And certainly, we're not going to get into everything that you need to know about Medicare today, but we'll point out a couple high-level things. I think the big thing is we just talked about is, hey, you are eligible for Medicare at 65. Now, of course, if you're still working, that doesn't mean you necessarily have to go on to Medicare at 65. You do have some options that are afforded to you. Some individuals have to, just depends on what current coverage that you have through your employer and if it's considered a qualified healthcare plan or not. But most individuals are once they hit that 65, their retiree medical is going to run through Medicare. Traditionally, that Part A and Part B. Part A covers hospitalization care, and then of course your Part B covers your physician's care, so on and so forth. So those are almost the core as I think about Medicare. Most individuals and families are not going to have to pay a monthly premium for your Part A. There are rare cases where you do, but for the vast majority of us, you're not going to pay a monthly premium for your Part A, but you are for your Part B, which most individuals are paying about $174.70 in 2024 for your Part B, unless you get hit with that nasty Irma, which we've talked about many times.
Oh, the Irma! I remember
Part
that
B
episode.
Premiums can go up. Yep. Absolutely. So, that's the core. Most individuals, once they turn 65, that's the first step is to try to get that Part A and Part B coverage in place. And then, of course, just as anything, you do have some other options. And that next step or that next big option, once you get signed up for Part A and Part B, is deciding on, hey, do you want to go with an Advantage plan, sometimes called a Part C plan, or a supplemental plan, sometimes called a Medigap plan. There are pros and cons to both of those plans, but that is, a decision that every individual is going to need to make. And then once you make it, that can kind of flow down through and, you get your drug card or your Part D coverage, depending on, what you decide from an Advantage or supplemental plan route. But Medicare is there, like I said before, for many individuals. And, from a cost standpoint, you're starting at about $174 $1.70 per month. Now, of course, as you look at any of these healthcare options, while there are some pitfalls and some things that we just want you to be a little bit mindful of, some of these are going to get pretty granular and might not apply. But if they do, these are things that are going, we absolutely want to be mindful of. And I think the first thing that I want to point out is just really making sure that you understand the deadlines for each of these plans. I think we mentioned the one on COBRA, right? You have 60 days to make that election from the time that you lose coverage. For Medicare, you have an open enrollment period, which is like a 7-month window around your 65th birthday. So 3 months before, 3 months after. And, if you decide not to go on Medicare at 65, then at some point down the road, you will have what's called a special enrollment period. These enrollment periods, if we don't hit them in the case of Medicare, you might be paying a penalty on your Part B and Part D premiums. For COBRA, in that case, if you miss that 60-day window, you can't get back on it, right? So being mindful of these deadlines for individual healthcare plans and marketplace plans, open enrollments typically, in November and December, for the upcoming year. And then of course you have that special enrollment period, should you lose your coverage where you can get in. But understand those deadlines. Also, I think it's important to, if you are in a very lucky situation where your employer is providing you some healthcare benefits, retiree healthcare benefits, understanding how those benefits work in conjunction with all these other options. I'll tell you what, it's almost a job in itself, right? Because a lot of these employers, what they'll do is they'll offer you like health reimbursement arrangements or HRAs. These are accounts that, where the employer maybe puts money in for you and you get a debit card tied to it and you're able to use it throughout the year to cover certain medical expenses as they come up. These are wonderful benefits, and a lot of times your employer will, help alleviate some of those healthcare costs by, giving you this. But what that does is that makes you not eligible for like an HSA account or a health savings account or certain tax subsidies if you go onto a marketplace and being able to get them. So it is important for you to understand how those retiree benefits work with marketplace plans or, individual healthcare plans to make sure that you're, taking advantage of all the benefits that are going to be afforded to you. The other kind of little caveat there with employer provided healthcare plans is retiree healthcare plans specifically is a lot of times, they'll make you go through certain programs or companies to get those benefits. VIA benefits is a big one that I run into quite a bit here in Northeast Ohio, to where, some of the teachers and some of the government employees where they have to actually use VIA benefits to enroll in their individual healthcare plans that they decide to go with, once they retire. And if they use that company, then they would get, certain benefits and lower premiums afforded to them to be able to do it. You absolutely do not want to be, if you have that as an option for you, you don't want to be going to a normal broker and not being able to get, some of those benefits that the company has set up for you. Well, and sometimes we don't have time to plan for it, like in the situation of a layoff or, something happens to your position. I mean, you're kind of thrust into this, and I think the first thing to do when you kind of try to wrap your arms around what options are available to you is just really understanding what the employer is going to, give you and has available to you in the form of retiree medical benefits, whether that's just COBRA or something above and beyond that. And then you can sit down with your financial professional that kind of understands all these other options and say, hey, what in your situation is going to be applicable, and what do we do to kind of get the information we need to do a very fair comparison on that versus what the employer is going to afford to you, and then build the plan around it. And that's kind of, I guess, the end all be all, as I kind of, we're putting a wrapper and, a button on the podcast today is, truly making sure and understanding that healthcare decisions should not be made in a silo. As you could imagine with the marketplace plans, your income is going to determine a lot of what those healthcare premiums are. You have these deadlines. There is the full financial planning suite of options that are going to be available to you as you kind of think about this healthcare. And, certain things are going to pull other levers. And we really just want to make sure that you understand all those levers that you can pull and when to pull them to make sure that you're making the best decision for you. Because, one individual situation can be vastly different and have a whole host of different options from family to family, I guess, is a better way to put that. So just understanding those and making sure you have a plan around them and making decisions for them, I think is extremely important. And not only that, but obviously it'll give you some clarity and confidence to, make the right decision, whether it's when to retire or what healthcare plan that you need to choose from if you get thrust into the situation in the form of a layoff. But in either case, knowing your options is going to be key.
One last question for you before we wrap up, and this is more just of a personal opinion. We sort of started off talking a little bit about, all right, options are disappearing for healthcare for retirees, so that's a problem, and it feels like, okay, well, at least we have, kind of two choices here between COBRA and the marketplace, but then you outlined a couple of other different angles that we can take to fill these gaps. So from your perspective, and if we just keep in mind kind of this narrow band of folks who are prepping for retirement, so kind of in that, I don't know, we'll just call it 55 plus or 60 plus range, somewhere in that vicinity. What's your opinion, just your personal opinion as a planner? Do you see this as enough options and enough flexibility for most of your clients that come through the door to be able to find good solutions? Or do you feel like we're still really lacking in terms of options and choices for folks?
Oh, we'd always like more options, Walt.
You
always. I'm never going to
sure.
say we have enough options, but I do think that there are enough options out there to be able to fit one. It might not be the cheapest, it might not be the best coverage, but there are at least some option for everyone. And if you happen to be one of those individuals or those families where you don't have a small business, you don't have 1099 income, you want to retire before 65, you have other income coming in, so it's hard for you to be able to manage your tax brackets to pick up tax subsidies. Well, then at the end of the day, then you need to build the plan around that extra expense. And then it comes back to that old decision point of not having fear of the cost, but building a plan and putting a plan in place to be able to say, all right, this is what the cost, let's build it in, and let's, make sure it doesn't derail, my other retirement goals and my other retirement things that we're trying to accomplish in the way that you live your life in retirement. So I think there's enough options. Certainly we'd always love to have more, but we can get through the decision. And there's, retirees, are retiring every day, and they're dealing with these same issues. You're not any different. We can get you through it. And it's just key is having some type of plan in place to be able to get you there.
Okay, very good. Well, if you would like to talk with a member of the True Wealth Design team to discuss your financial plan, and if you've never taken this deep of a look at your healthcare options, if you're thinking about especially retiring before that Medicare age and you're wondering how you're going to bridge that gap, hopefully you learned a little something on today's episode about your options, but always best to get that individualized guidance, advice, and consultation. And you can get that by going to truewealthdesign.com and click the Are We Right For You button. That'll let you schedule a 15-minute call with an experienced advisor on the team. Just go to truewealthdesign.com and again click Are We Right For You. You can also call 855-TWD-PLAN, 855-TWD-PLAN to touch base with the True Wealth Design team. You'll talk to Tyler, Kevin, or another great member of the team about your situation, get some early guidance to see if you're fit to work with one another, and then start diving into the actual planning process and hopefully improving and turning around maybe your financial plan, where it is right now and where you're headed, and get a more secure path forward with a review and a better plan in place. Tyler, thanks for all the help on today's episode. I feel like I learned a couple of things today, and now I'm kind of regretting I didn't trigger the egghead alert on you. Just for not that it would have been your fault, but just for the fact that multiple employer welfare agreement, small business, COBRA consolidated, omnibus budget reconciliation, just like the accumulation of those words should have led to an egghead alert. But
fair enough.
We'll do better next time and try to trigger it. Okay.
Sounds good.
Hey, thanks for all your help, and have a great rest of your week, and we'll talk to you in June.
All right, have a good one.
All right, thanks a lot. That's Tyler Emrick. I'm Walter Storholt. Thanks for joining us. We'll see you next time, right back here on Retire Smart.
Information provided is for informational purposes only and does not constitute investment, tax, or legal advice. Information is obtained from sources that are deemed to be reliable, but their accurateness and completeness cannot be guaranteed. All performance reference is historical and not an indication of future results. Benchmark indices are hypothetical and do not include any investment fees.